Welcome back to my channel Medical School. I hope you all are doing well. Today our topic is jaundice, its symptoms, causes, diagnosis, treatment, prevention and types. Before we going in detail, let me tell you the basic things about the jaundice. Jaundice causes your skin and white of your eye to turn yellow. It's a symptom of a disease rather than a disease itself. Too much bilirubin causes jaundice. Bilirubin is a yellow chemical in a hemoglobin, the substance that carries oxygen in your red blood cells. A number of different conditions can cause jaundice. Let's start the definition. Jaundice is a condition in which the skin, whites of eye, and the mucous membrane turn yellow because of high level of bilirubin, a yellow-orange bile pigment. Jaundice has many causes including hepatitis, gallstones, and tumors. Symptoms of the jaundice: fever, chills, abdominal pain, flu-like symptoms, change in skin color, dark color urine or clay color stools. Causes of the jaundice. Jaundice is caused by excess of bilirubin, which is formed when hemoglobin is broken down as a part of normal process of recycling. It recycles the old and damaged red blood cells. Normally, the bilirubin is processed by the liver and excreted into the digestive tract. Diagnosis of the jaundice. Your doctor will give you a bilirubin test, which measures the amount of substance in your blood, a complete blood count (CBC), and the other liver test. If you have jaundice, your level of bilirubin will be high. Treatment of the jaundice. Anemia-induced jaundice may be treated by boosting the amount of iron in the blood by either taking iron supplements or eating more iron-rich foods. Hepatitis-induced jaundice requires antiviral or steroid medications. Doctor can treat obstructions-induced jaundice by surgically removing the obstructions. Jaundice can be prevented by avoid hepatitis infection, stay within recommended alcohol limits, maintain a healthy weight, manage your cholesterol level. Bilirubin is a product of red blood cell breakdown. When red blood cells are broken down by macrophages, they release hemoglobin. Hemoglobin is broken down into heme and globin, and the heme is further metabolized in unconjugated bilirubin. Unconjugated bilirubin is water insoluble, so it is carried in the bloodstream and albumin and delivered to the liver. Once the unconjugated bilirubin is taken up by the liver, it is conjugated by the enzyme UGT diphosphate and then excreted the bilirubin into the gallbladder and intestine. Once in the intestinal tract, most conjugated bilirubin is excreted through the feces, but some is back to the unconjugated bilirubin by the enzyme beta-glucuronidase and reabsorbed into the bloodstream to start the cycle again, and the process is called enterohepatic circulation. In newborn, first they typically have high hematocrit, on average around 60, fewer red blood cells with shorter lifespan, both of which increase the potential for the red blood cells to turn over, and thus unconjugated bilirubin production start. Second, they slowly metabolize unconjugated bilirubin because there is just starting of increasing UGT1A1 enzyme, which is non-active. Third, as the baby learning to feed, excretion of the bilirubin is in the stool may be decreased. These processes led to the physiologic jaundice in the newborns.